Welcome back, everyone. Today we're diving into the engine room of the human body, skeletal muscle. But we aren't just looking at names and locations, we're talking about the blueprints, the architecture. Dr. Sarah, I'm excited because most students think a muscle is just a muscle, but the way those fibers are laid out is the difference between a Ferrari and a freight train.
Exactly, Dr. Khan. From an academic and board prep perspective, understanding muscle architecture is essentially a lesson in physics. You have to understand the trade-off between range of motion and raw power. The USMLE loves to test the relationship between fiber orientation and the muscle's functional output. So let's start with the basics, the parallel fibered muscles.
Right. Think of parallel muscles like a long bungee cord. The fibers run, well, parallel to the long axis of the muscle. This is your sartorius in the leg or the sternocleidomastoid in the neck. Because these fibers are long and run end to end, they can shorten by a huge margin, usually 1/3 to 1/2 of their resting length. I call these the excursion kings.
That's a great term for them. Excursion is the key word here. If a fiber is 10 centimeters long, it can shorten by 5 centimeters. Because parallel muscles have long fibers, they provide a massive range of motion. Clinically and academically, you should associate parallel fibers with speed and distance, not necessarily maximum force. If you see the sartorius on an exam, think maximum travel, moderate power.
But Dr. Sarah, why does this matter clinically? Well, imagine a patient with a nerve injury affecting a parallel muscle. They don't just lose strength, they lose the ability to move a joint through its full arc. If you're a surgeon, perhaps the doctor of choice for a complex limb reconstruction, you have to respect that excursion. You can't just swap a short-fibered muscle into a spot that requires a long-fibered parallel muscle and expect the patient to reach their toes.
Precisely. Now, let's contrast that with the power lifters of the body, the pennate muscles. The word pennate comes from the Latin pinna, meaning feather. Instead of running parallel to the line of pull, these fibers run obliquely, at an angle, into a central tendon.
I love the feather analogy. It's like a quill. You have the central stick, the tendon, and all these little fibers branching off. Now, Dr. Sarah, for the high-yield facts, how do we categorize these?
There are 3 main types you'll see on the boards. First, unipennate, where fibers approach the tendon from one side only. Think of the extensor digitorum longus. Second, bipennate, where fibers come in from both sides, like a classic feather. The rectus femoris is the classic example. And third, multipennate, which looks like a bunch of feathers joined together. The acromial part of your deltoid is the textbook multipennate muscle.
And here's the clinical why. Why would the body tilt the fibers at an angle instead of keeping them straight? It seems inefficient, right? Wrong. By angling the fibers, you can pack way more of them into the same volume of space. It's like a parking lot. If you park cars at an angle, you can fit more rows than if they are all parallel to the entrance. More fibers mean more physiological cross-sectional area, or PCSA.
Dr. Khan just hit the board exam jackpot with that term. PCSA is the total area of all those fibers cut perpendicular to their orientation. Because the force a muscle produces is directly proportional to its total cross-sectional area, pennate muscles are significantly stronger than parallel muscles of the same size. However, the trade-off is that their fibers are shorter, so they have very little excursion.
Exactly. They are the tractors. They won't move the joint very far, but they will pull with enough force to move a mountain. Look at the tibialis anterior. It's multipennate. When you're walking, that muscle has to lift the entire weight of your foot against gravity with every single step. It doesn't need to move the foot a meter. It just needs to pull hard for a few centimeters. If that muscle were parallel fibered, your leg would have to be 3 times as thick to generate the same force.
To recap the high-yield differences for your exams, parallel muscles equal high excursion and high velocity, but lower force. Pennate muscles equal high force due to increased cross-sectional area, but lower excursion because the fibers are shorter and angled. If an exam question asks which muscle is designed for power, look for the pennate options.
And clinically, think about muscle atrophy. When a patient is immobilized in a cast, the multipennate muscles often show the most dramatic changes in shape because they have so much bulk to lose. Understanding this helps you tailor their physical therapy. You don't just train them for movement, you train them to regain that specific cross-sectional force.
Well said. The architecture dictates the action. You wouldn't use a flat parallel muscle like the sartorius to stabilize a heavy load, and you wouldn't use a short pennate muscle to perform a wide sweeping gesture.
Bottom line for today, structure determines function. Parallel fibers are for the long haul and the big reach. Pennate fibers are for the heavy lifting and the tight spaces. Keep that parking lot analogy in your head and you'll never forget why the deltoid is so strong.
Summary for the road: parallel equals range, pennate equals power. We'll see you in the next session where we tackle the nervous system's control over these engines.